Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our second segment for today. This is, of course, our COVID-19 update brought to you by Fulltech Systems. And we are joined by internist and intensivist at the Belize Healthcare Partners Limited, Dr. Jorge Hidalgo, as we take a look at year 2 of the pandemic and some of the questions that still aren't answered. Good morning, Doc.
Good morning, Doc.
Good morning. Good morning. Happy New Year.
Happy New Year to you too.
For 2021.
Yes, and the same to you. We are all moving into this new year highly optimistic that things will improve when it comes to the situation of the pandemic. So we wanted to get the chance to put things into perspective. A year ago, this time, COVID-19 or the novel coronavirus wasn't even on our radar in Belize as yet. It was just becoming an issue, I know, with the WHO and the cases detected in China. Let's look at some of the things and some of the questions we were able to answer last year before we talk about this year.
Yes, well, as you already mentioned, our global coronavirus nightmare is entering in second year. Mm-hmm. And of course, we are hanging there the best we can. Our world essentially has been put on a pandemic mood. Mm-hmm. And of course, there are many things that we see how the virus continues to spread, and essentially our lives was essentially put and turned upside down. We see how hospital and healthcare workers are overwhelmed. And as you mentioned, there are many questions that are still unanswered. Mm-hmm. Particularly, one of the questions that we still don't understand is the transmission of how this virus came up. No? Mm-hmm. Of course, we have and we manage the theory that the virus essentially initially came from his primary reservoir, who is the bat, mm-hmm. and then the secondary intermediary, who is the pangolin, as they show that the pangolin have his genomic structure is similar like the coronavirus. No? However, we don't know as yet that this is something that probably just the time it will reveal. No? Okay. But that is the theory that we so far managed. No? Yeah. And as you say, a year ago we was entering into unknown medical condition. It took us by surprise, as many countries that we believe have the best healthcare in the world essentially reveal the weaknesses of our healthcare systems, not only in Belize but around the world.
Yeah. When we look back at last year, the year of learning and even unlearning things about this new disease, there were some certainties, I think, that we were able to determine, or that scientists, I should say, were able to determine. You know, first there was a question of whether masks would work. Now we know they work. At first they thought it was a primarily respiratory illness, and now we know that the virus attacks more than just the lungs. It can attack any other part of the body as well. Talk to me about some of the things that we know moving into this year about COVID-19.
Well, as you will say, we enter in last year with a very trying to understand the behavior of the virus, and that, of course, we enter into our learning curve around the world. Mm-hmm. Now we know a little bit more. Unfortunately, I say that we know a little bit more because, despite of all the efforts, as you see, COVID-19 is still taking many lives. Mm-hmm. We in terms of our armamentarium of medication, we are still limited to few that it shows approved based on the randomized clinical trials that work. No? I mean that despite of that efforts that the scientific community around the world have made to trying to develop and also to provide us with more resources in terms of treatment, the treatment is still basic, limited, essentially supportive in especially for those patients that get critically ill. No? I mean that most of the effort are that we or most of us are recommending is trying to prevent the condition to get into a point that we are that is high or we are essentially out of control. And one of the hopes everybody have is that the vaccines it will help us to provide the people with the herd immunization that we have. And when we talk about the herd immunization, we talk about the resistance to the spread of the infections disease within a population.
What are your thoughts on how fast the scientific community was able to move insofar as researching and coming up with a vaccine for COVID-19? When you look at other pandemics that may have affected the world in the past, you would have had years to study how to find the right medicine and treatment and what have you. But in this particular instance, it was only a matter of months. It's within a year that they had to, work tediously to find a vaccine or find some way to combat the disease.
Yes, that's a good question. No? That's probably one of the fears that many people have in terms of how we are going to get the vaccinated with a vaccine that probably was developed too quickly. What are the security I have? But the effort to develop a vaccine for coronavirus, it started with SARS in 2002. And then also with Ebola. Those two type of vaccine essentially help us as a platform to facilitate the development of the vaccine for SARS-CoV-2 or COVID-19. I mean that we already have like we can say, a plan for the vaccine that help us and facilitate the development of this vaccine more rapid. And of course, the fact that each technology or vaccine or whatever medication needs to go to a clinical trials, and then as you see that also in terms of the time, the different regulatory organization essentially facilitate the process for this development to be a little bit faster, especially for the phase 1, phase 2, and of course enter into the phase 3.
Yeah. So when we look at some of the information we were able to obtain in 2020, we learned transmission, we learned signs and symptoms, and I know that there is a lot of work in looking at treatments, but as you rightly noted, there's no definitive treatment as yet for COVID-19. Let's move it forward to this year, and let's talk about some of the things that are still unanswered. One of my questions is to look at the issue of reinfection. Is there any definitive study as yet as to what are the risks for reinfection?
Yes, that we know so far is that when you get infected with COVID-19, that will provide with a period of immunity that runs in probably 3 months or we can say 40 weeks. That's still not completely sure. We're still in terms of what is the immunity that we acquire, that we know that is not a definitive. I mean that that's one of the things that we know that if you get COVID-19, the chances for you to get reinfected is there. I mean that because most of the time people get infected, and it provides the people with certain confidence, and in a way we can say acting in an irresponsible way, because they say, okay, I already contracted the COVID-19, then I'm not wearing a mask, or I'm not going to follow the different social distancing measures that we know and that been proved that are working. I mean that is we know. I mean and that you can get reinfected.
What are some of the other questions that are lingering as we move into 2021 about COVID-19 and the pandemic?
Well, probably the most important question, and that I believe all of us are essentially seeing and moving, is what the vaccines are going to offer in terms of immunity. We know that most of the vaccines are essentially two dosage, meaning that the first dosage, they don't give you the immunity. We need to wait for the second dosage. Mean that also we are looking at what is going to be the amount of population that finally are going to be able to get the vaccines. Of course, the most important question for countries like us is how soon the vaccine are going to come into our country. According with the COVAX agreement and compromise, is that the vaccine is going to enter in the first quarter of the year. I mean that probably could be April or May. But of course, those are the things that we would like to know with certainty, no? And of course, as we know that initially the vaccine are going to be offered by the frontline workers, as well as for the more vulnerable population.
And what about long-term effects of COVID? Those are the questions that we don't have answers to as yet, right?
Exactly. As I mentioned, for long-term, one of the most important things we would like is that, as I mentioned, that the vaccine and that we'll be able to immunize as many people as we have that can provide with the population with the herd immunization that we want. Of course, I don't think so. This year, that goal is going to be able to reach. I mean that I think so. We will probably enter 22. We're still battling with the coronavirus. Probably not as bad as we are seeing it right now.
Yeah.
Sorry.
Sorry.
Go ahead. You go ahead.
No, I was going to ask if there's any information on why some people get severely sick and why others don't.
That's probably a good question. As we are seeing some of people get really badly sick, and they enter into the ICU battling with a really bad type of the COVID-19. Versus probably other person that probably was at the same time and exposed to the virus, and they probably have just mild symptoms of no symptoms, no. Yeah. And one of the things we are learning is that if it had essentially with the genetic information or the phenotype of each individual. Of course, there are too much to investigate about it, but for now we know that this is more or less is basically the individual phenotype that allows the virus to be more aggressive in some people and less or no symptoms in other people. No? As also one of the other things we are seeing in severely affected people that make it true is that all the patients are experiencing something that we call it the post-COVID-19 lung. And what this exactly means is that the COVID-19 will cause some scar tissue in the lungs. Medically speaking, we call it a fibrosis that will essentially make them difficult to get through, and is a process of 4 to 6 weeks to 8 weeks for the patients to back to a normal life. And some of them, of course, we will need to see a more long-term period, but seeing some of the patients that became very sick at the beginning of the year, some of them are still battling and still on oxygen at home.
And do we know if any of these long-term effects are permanent?
That's we are seeing in some patients that had the COVID-19 severe, that some of the patients are still adapting and still on oxygen. Fortunately, it's not a big group of population, but it's something that we are start to seeing, and it's something that also we need to prepare for.
Do you foresee that as a Belizean society that there are going to be some who will take a anti-vaccine approach to the rollout of whatever vaccine we have coming in the months ahead? I know that, for instance, in the United States, you have people who have taken a staunch position against the vaccine. Do you foresee that perhaps we'll also have to go through some form of a campaign to raise public awareness on perhaps the benefits of getting vaccinated?
Definitely we need to, because of course there are too many misinformation about the vaccine. No? And of course, if you probably recall, even before COVID-19 and before this vaccine, from years before, there are certain group of population that are against immunization. And that's the reason why some of the conditions that we thought was already disappeared, we start to see now, like poliomyelitis, measles, that we are start to see cases now, you know, that we thought at some years ago that we have it already well controlled and probably eradicated. No? However, we due to this campaign against immunization, now we are seeing measles and we are seeing some cases of poliomyelitis as devastating, especially poliomyelitis are.
You know, and looking forward, one of the things that the WHO officials noted in their end-of-year wrap-up was that COVID-19 is most likely set to become endemic, which means it'll be a disease that will linger and people may catch at any time of the year. So what does that say, what does that mean for you when you look at that particular situation for us in Belize, since we're talking about unknowns?
Yeah, that is something that we know, that the COVID-19 is here to stay. We don't expect the COVID-19 to be controlled. At least, even with vaccination, we know that there's a certain amount of population that we are going to get vaccinated this year. We don't expect the whole population to be vaccinated. Mean that we know that over the following a couple of years, we are going to see cases of COVID-19, hopefully less and less. And hopefully the other vaccines get approved, that we can be able to immunize a larger amount of population to control that.
Yeah. And one more unknown variable, I know there was a small study done looking at the impact of COVID-19 on asymptomatic patients, and they found that there was some changes within some of their organs. Do we know definitively as yet as to what is the long-term effect on asymptomatic patients who have no symptoms whatsoever?
Well, so far, no. That we know is for patients that they have some uh, have the condition very serious that we for sure know now, and we've been documented the effects of the COVID-19 in many ways. No, COVID-19 by itself and COVID-19 after being admitted in ICU. Mean that we see the effects that by COVID-19 itself is the affection of the lungs as a long term, and again we need to know, and we are follow those patients closely just to see how long the damage is going to be. Some of the lungs have really bad scar tissue that it can be affect them. We can say for the rest of the life, and of course the economic impact that have over the families. No?
Yeah.
In an acute phase, we see that, as you mentioned already, the COVID-19 it can cause a multi-organ failure. COVID-19 it can cause. We see patients that essentially they take the liver, kidneys, blood system. We see the lungs. We see brain, and the brain also. Patients after COVID-19 experience something like a post-traumatic stress disorder, problems sleeping, nightmares, along with the weakness and the fatigue that you experience for the following weeks after you've been discharged from the hospital.
Wow. And the mental health toll, that's
Yes.
also one of the unknown variables here.
And especially for those patients that are, imagine you to be in a room and entering the third and the fourth week, and then you're still dependent on oxygen and not knowing what is going to happen. No? And that it takes a lot from the people.
Doc, as a physician, and I know that one of the hardest adjustments of 2020 was accepting that there was just a lot of responses that said, we don't know yet, from the world's top officials. Moving into 2021, for you personally in your practice, you're dealing with COVID-19 patients in the COVID-19 unit there. What's one of the questions that you would like definitive answers to sooner rather than later?
Well, probably one of the most important aspect is to be able to access medication, or at least to have a medication that it will definitely help, no?
Yeah.
Dealing with COVID-19. For right now, the medication we have is a supportive medication, is to control the amount of the inflammation that this virus causes in the body, but it's not like if you are treating a bacterial pneumonia and you say, okay, this is the antibiotic, and you will know with certain level of evidence that in X amount of days the pneumonia is going to subside, and you can discuss that with your patient openly. But this is not the case with COVID-19. Despite of medications that we have that been in a certain way prove that they control the inflammation, you see your patients in the first, second, and third day, and you have your hand tied and hoping that the patient is going to respond, and some of them respond very quickly, and some others it takes days. I mean that the most important as treating physicians, we probably one is to be able to have the proper armamentarium to deal with this COVID-19 disease.
That makes a lot of sense. And while we have talked so much about vaccines, is there any progress being made on effective treatment?
For vaccines or for
No, for COVID-19. Vaccines are preventative, and I know we talk about that a lot. but the other aspect is being able to adequately treat it, as you pointed out. Has there been any progress in any part of the world?
So far, no. So far, there are many, as you see, there are many news and many information, but so far, in terms of vaccine is what we know now, and in terms of treatment is what we have right now. Of course, there are many randomized clinical trials, and I want probably the people to understand that when we talk about randomized clinical trial, we're talking about a double-blind study where certain amount of population, a bigger amount of population, are placed on something that we call it placebo and something that we call it the medication itself. To prove that this medication is going to be effective. I mean that most of the times, and especially for COVID-19, for us to be able to say, okay, this is the medication that is helping now. These medications need to go to clinic, to randomized clinical trials, and that's why for now we only have a few of them that we can use.
All right. And looking forward, anything else when you, as we enter into year 2, that you're hoping we'll be able to achieve?
Well, the most important thing, and I think so, what we are hoping is to be able to access the vaccine as much as, and to hopefully by the end of this year, an important group of the population can have access to the vaccine. To be able to achieve the immunization and to try to slowly go back to a more reasonable way of life. We know that to have to back to our normal lives as we live before COVID-19, I think so it will take a while, and we need to be responsible in knowing that, and knowing that we need to continue practicing that we every day insist. Social distancing measures.
That's right. That's one certainty we know. Those continue into 2021. All right, Doc, thank you so much for joining us this morning. We appreciate you taking the time to put year 2 of the pandemic into perspective. Please stay safe.
Thank you. Same to you.
All right. And with that, we're going to go ahead and take our break. And when we come back, we'll be joined by a life coach to talk about planning for 2021, even in the middle of a global pandemic. Please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.